So Stephen and Martin have told us about the importance of research and what our research priorities should be in Sussex. And Wendy and Virginia have told us about the infrastructure that we need in order to conduct high quality clinical research. I'm going to tell you how we can support to actually have people to do clinical research, because it's all very well having goals, ambitions, ideas, but we need bodies on the ground to conduct the research, and how can we support and grow these people locally. So my name is Jess Eccles. I was recently made reader in brain body medicine in the Department of Neuroscience, and I am a graduate of something called the Integrated Academic Training Pathway. That meant many years ago, when I finished medical school, where I had done an intercalated degree, I went on the academic foundation program, and I went through a training program right from the moment of leaving medical school to the moment of becoming a consultant, of combining my clinical work with research and learning how to become a researcher and doing a PhD. And as you can see, I got to the end, the consultant bit, and then an academic position. And this process started actually in 2006 when I graduated from medical school. So you can see it takes a very long time. But what we want to do is to encourage and support the doctors on this training program. And it used to be that we were allocated a certain number of those per year by a formula system according to the size of our medical school. Now we have to compete for them. We have to demonstrate that we nurture our academics, that they produce good outputs. And so it is in our interest to make sure that we are supporting academics and providing them with as many opportunities as possible. And so this is where we have the idea of the research training hub. Some people may be familiar with the idea of this as something like a clinical academic training office, which places like Imperial and King's have. So we are working towards the idea of such support for people. So we need to grow the researchers of the future. We need to develop a profile of excellence that means that we encourage people to come and work here. And we need to make sure that this leads to real impact. And I am confident that we can do this, but we need to work together and we need to pool on the resources of the partnership. So this will be a centralised, multi-professional liaison and training hub. When I talked about the pathway that I took, that is one that is particular to clinical, to medics in training. But what we want is to develop clinical academic research across health professionals, and in fact, indeed, even in social care. And so this training hub will act as a single point of contact for advice, best practice, information, recruitment. It will provide training and development, and for all stages of their training. And this is just how the thing is. And the delivery group will lead into the HRP exec. But essentially myself and Dr. Kate Bell, who is the University Hospital Sussex Research Lead for nurses and other allied health professionals, we are going to be working with the delightful new Amy Darby, our senior coordinator, and we will also be employing a research methodologist. And we will be working really hard to try and encourage people who are on the ground, seeing patients, knowing what the priorities are, to actively get involved in clinical research that is meaningful. So this is what we hope to offer. I'm not going to bore you, but essentially it's about creating a nurturing environment for the trainees so that they feel confident to put in those grants to the CTU, to use the JCRO, and that by investing in local academics, we can help meet the priorities that Stephen has identified.